so long waiting for you to call me. You're the only one I want.
Back to my channel if you are new. My name is Candace. I'm a first year nursing student. I was about to tell you my school. No. I'm a first year nursing student and I technically start clinical tomorrow. So we had an introductory day where we basically just shadowed just to kind of learn the unit of the hospital that I'm placed at. We kind of just walked around, saw the flow of the day. We did some like documenting training and made sure we had access to all the systems. So it was just kind of like an orientation day. But tomorrow I actually start my full 8-hour shift where I will be assigned a patient, so that is very exciting. So I just thought I would share what I packed in my bag. So this bag itself is from Amazon. A lot of people on here do use this bag. It's from the company BagSmart. That's on Amazon. So I just got mine in the pink color and it has lots of pockets. This is like the if you want to slide it on a suitcase for traveling. It has 2 very large pockets on the side. Also has a pocket in the front that sits. And then I'm gonna go into what's inside the bag in a second. So starting off, I just have this laptop case, but I actually don't have my laptop in it. I have 2 things. So I have a folder here. They require us to basically have our immunization records and like our COVID shots and our documentation that we have had our mass fit tests. They just want us to have all of those things on hand in case somebody asks you for it. We did upload everything into the into the database, but they said to still have it. So I have all of my information printed off in there just in case. In this folder here, our school uses what we call a worksheet. So basically you can fill out your patient's information, the vital signs and stuff would go in here, and then whatever you assess. We have different categories. We have cardiovascular, special needs of treatment, neurological, respiratory, etc., etc. So everything can kind of be filled out here. You don't have to use this, but it is a good guide in case you like forget stuff. So I have that printed and ready to go for tomorrow. We also have a fluid balance worksheet. Again, you don't have to use this, and this is on the computer charting system anyways, but just in case our access isn't working tomorrow, we have a paper copy of that. 2 of those actually, 2 versions. And then we have our head to toe assessment guide. So if you want to start getting into the in-depth health assessment, this acts as like a rubric just to make sure you're remembering everything. And then we also have this, which is like a mini schedule sort of thing, just because we don't know the flow of patient care and everything by heart. This is just something that you can kind of jot down, like, oh, if my patient's going to physiotherapy at 11 a.m., I'll jot it down on my paper just so I remember to get them prepared and ready, dressed for the day. It just serves as a reminder. So I have those papers ready to go. I have another worksheet that I actually filled out that was based on a mock patient. So this is what it would look like. So this just kind of has cues and stuff on it for me to ask. So for example, in the gastrointestinal assessment, I'll ask the patient when was the last bowel movement. If it was greater than 3 days, talk to the physician about laxative use or check in their MAR to see if they have any. Anyways, getting too in depth. So I have one of those filled out already, and then I just have a bunch of copies of the schedule and the blank worksheet. So I have those. Those are ready to go. put those back. And then because I have so many papers, I'm just gonna walk around with a clipboard. I think it'll be a little bit more, you know, if I want to carry the papers, because I'll actually show you I have something else that I'm planning on carrying with me. I'll just see how kind of flows and how it works based on how busy it is, and you know, I'll just see. It's better to be prepared. And then the rest of these things are just kind of like some documentation about what we can and cannot do as a student. Some things about the unit that I'm on, like paperwork. We have some common like abbreviations in healthcare. So just some other miscellaneous things in case I need information. All that is printed out. So those are the 2 folders. I have a double stethoscope. I actually had to pick this up for my clinical instructor. So before we are able to use, they have like rolling machines that you can use that do the vitals and whatever. They just want to check that we know how to use the blood pressure cuff properly before they leave us on our own to use the mechanical one. Because basically once you start using the mechanical one, the electronic one, once you start using the electronic one, you're basically never going to do a blood pressure manually ever again. So I guess they just want to double check that we know how to do it before they send us off. So we will be doing this first thing in the morning. We'll practice on one another, and then they're going to let us go with our patients. So my teacher just asked me to pick this up from the lab for her, so that'll be for her. I have my assigned mask. They gave us one after we did a mask fit test, so I just put it in my bag. To be honest, I don't need to bring this because obviously the hospital's gonna have, but whatever. I have a bag with feminine products. I have my own blood pressure cuff to practice, like I said, the check off. So it just comes in this bag. So that's there. I have my stethoscope case. This is from Amazon. This is a hard shell one. And in here, I have my stethoscope, which is pink. It is a Littmann 3. Just looks like this. And then on the other side, I've got pens, pen lights, a little pocket watch type of situation, because I do have an Apple Watch, but they're kind of iffy about those because of the second hand, so whatever. Oh, and then I have, so this is a trick. People probably already know about this. So we started ostomy care, and one thing, if you have ever dealt with an ostomy, you know, stink. So one way I kind of like deal with that and like keep myself from not reacting is by using this. So this is called Lorraine's oil, and it's basically candy flavoring. So I have mine in the cotton candy flavor. So it looks like this. And basically you would just take your mask. So if you're using this, for example, just put a little drop on your mask, like try to line it up with your nose, and it smells like cotton candy all day. So it doesn't completely mask the scent of the stool, but it does a damn good job of kind of, you know, masking it. So I just prefer the cotton candy one. They have raspberry, they have peppermint, basically any candy flavor you could think of. You can just get it from this brand, and I got this at Michael's, but I'm pretty sure Amazon sells this as well. And Michael's did have a 3-pack, so I actually have one in my clinical bag, one in my lab bag, and then one that I keep in my backpack just in case I forget or one runs out. So that's what I keep in there. Put that back. And then this is the last thing that I have that I said I actually wanted to try out. So I just have like a pocketbook that actually fits right in the pocket of my scrubs. So this is easier than carrying around a clipboard per se. So when I want to write anything, and I have my pen right here, when I want to write anything, it's on me, right? And I don't have to put patient information on this. And so basically this was my first day, like the orientation. I just kind of jotted notes down here. So I have like 3 pages of notes in this already, but I just found this to be very convenient, and I would just like to see how it works in terms of providing patient care, because we actually don't have access. So sometimes you'll see nurses walking around with like, it looks like a phone, but they're actually charting on it as if it was the computer. So we don't have access to that phone because they don't want us to get in the habit of walking around with this little electronic device, because not a lot of hospitals have that, or if you get placed in like a long care home, they won't have that either. So they really want us to focus on like hand charting or like trying to memorize the details, but we're not there yet. So I'm gonna try this, and I'll give the worksheets a try, and I'll just see which one I prefer. So last thing that I'm going to put in the morning, just because I have to charge, is going to be my iPad. So this is my iPad case, and in here I've just got my keyboard, and I actually have the Magic Keyboard with the touchpad. I'm not sure where my pencil is at the moment. I think it might be in my school backpack, so I'll have to put that in here after I charge it. I also have a charger, screen wipe, and then the iPad itself. So this is just the case that comes with this, so it's not cute or anything, but it's fine, it'll do. So yeah, after I charge this, I'll be putting this in my bag tomorrow, and this will only be for if I need to do any sort of research for whatever condition or whatever my patient that I get has. So if I need to look up anything, look up any medications, and it seems like we're going to be having debriefings after like after lunch or something, like, hey, just talk about your day, like what's going well, whatever, and talk about any assignments that we have to complete. So this will be good for note taking. So I will pack that in the morning. But that is basically it for my clinical bag. I will have a separate lunch bag. The place that we're at does not have a cafeteria, so they're really big on pack your lunch, whatever, because we don't have any snacks here. They have like vending machines, but I don't want vending machine food. So yeah, that'll be it. Oh, and I'll be putting my badge in there. So I have these badge reels. I'm just gonna hide it because I don't want you to see my school. But I got these in the pack of 4 or 5. These are just the Avengers. So I have the Captain America one on right now, but it came with Captain America, Hulk, I want to say Iron Man, Spider-Man, and Thor, I believe. But yeah, they're super cute, super sturdy. I have about 1, 2, 3, 4, 5, 6, 7 cards on it so far, and it's holding up good. For these cards, our school actually gave us 2. So this is a PPE card, and this is another PPE card, but it gives you like common diseases and then what precautions you would use. So this is really good. And then my friend actually got these for a whole pack of these. Actually, I think it came with 40, but I just kind of add on based on what unit we've done, just so I'm not like confused and have too many things on here. So this is from nurseiq.com if you want to grab a couple. This is good to use if you are in a Canadian system, because that was a problem I was finding. There's the nursing school bundle that's really popular. All of the lab values and stuff in that are based on the American system, and Canada doesn't use the same thing. So that was a big thing for me. And the Nurse IQ has it. So there's just a nursing basic one with vital signs, heart sounds, and kind of where to listen, lung sounds and where to listen, the pupil, common lab values, another isolation precaution one. The head to toe assessment is actually on the card, so it tells you what to do. General, eyes, ENT, neurological, respiratory, cardiac, skin, musculoskeletal, gastrointestinal, everything is on this one card, which is really nice. So I probably won't even have to carry that head to toe paper actually, now that I'm thinking about it. And then this last one that I have here is on med calculations. So the only thing that we're doing at the moment is going to be dose required divided by dose on hand times quantity, the generic dose calculations, but it does have infusion time, infusion rate, drops per minute. So I don't know what those things mean because I'm not there yet, but it is pretty useful. And then on our ID itself, so this is my ID. Oh, I should probably, yeah. This is my ID, and then we just have the stickers from our mass fit test on here. So yeah, so our uniform is thankfully all blue and not white. I basically have to wear my uniform every day of the week. So I've got a few of these, so basically I just pin it on top and then good to go. So this is me. And yeah, so again, all of these pockets in this bag are definitely not filled, but I guess when I get into the swing of things and I figure out what I need, what I don't need, based on just based on how the workflow is going, I'll be able to reassess what I need. But that's all I have for in my bag. I'm just gonna put these things back, and I actually did want to show you guys my actual school bag. So our school, not my school bag, but our school lab bag. Our school gave us a lab bag. So these are the things that we'll be practicing with in clinical. I just wanted to go through that as well, because I'm not sure if everybody gets the same things like for year one. Like, I don't know if everybody does the same kind of course outline, but I'll be interested to know what you guys got in your first clinical bag if you want to chat about it. These are my own personal supplies when we did our bathing the client unit or hygiene unit. So I just keep this bag in here. I don't use it on me. All of these things are used on the mannequins and stuff we have in lab, so I don't use those. I've got a lemon glycerin swab stick that's actually supposed to be in that bag. We've got 2 Foley catheter kits. So basically how my school does it is they give us 2 of everything. So one we'll practice with, whatever. And then when it's time for our check off, we'll bring the brand new one and then kind of open it and go through the sequence with our instructor to make sure that we pass. So we have 2 of everything. We've got a suture removal kit. We've got sterile gloves. Again, these have been opened because we've been practicing with them. We've got a suture thing. I was gonna call it a suture pad, but is that what this is called? Like fake skin sort of thing. So this is what we're actually doing next week, learning how to remove these. So that'll be fun. And then we just got a bunch of gauze. We've got IV tubing in here. We've got a condom catheter. So this one's open if you want to see how a condom catheter looks. We've got a trach kit, a dressing tray. We've got 1 IV bag. I'm not sure how that works. I don't even know if this is a real IV. Like, I'm convinced this is filled with water and not a real like sodium IV bag, but that's fine. Got a Foley catheter. We start these in about 2 weeks, so that'll be fun. And 2 of these. And then, yeah, the rest of these are just doubles. Oh, they did give us a pen light, but I don't know how I feel about this one. So this one, there's like a covering, a little plastic thing that you slide, and then you hold it down and then the light comes on. But I like mine better, so I don't know if I'm gonna be using this. It doesn't look that cute, but it does have the pupil gauge on the side like everyone else. So yeah, if you want to, you can definitely let me know if you guys have the same supplies or did you guys get more supplies, and if you have, have you guys ever bought supplies on your own, and if from, where have you gotten it from? Because I would love to, you know, to do everything to me isn't enough. Like I'd like to practice a skill more than twice, or pretend to open something, pretend to be sterile or whatever. Yeah, like I'd like to practice it more than once. So if you guys have any tips, or if you guys have any websites or anything that I can buy things from, that'd be great. But I think that's all I wanted to show you guys. So yeah, wish me luck tomorrow. It's gonna be super exciting. I hope the patient that I get is gonna be, I don't know what I'm expecting, but I hope she's sweet. Or why am I saying she? It could be a man. I just hope they're sweet and they're patient and, I don't know, just like receptive of me in general. So we'll see. I guess we'll cross that bridge when we get there. So anyways, thank you guys for watching. Again, if you have any tips, tricks, that'd be great. I'd love to read what you guys comment. And yeah, I'll see you guys next time. Bye.
I'm so low and fall.